Are you experiencing tightness, weakness on your butt muscles with difficulty getting up from a chair, unable to walk far, difficulty standing for more than 30 minutes because you're feeling some hip instability already? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, I'll be targeting your gluteal muscles and how to activate your butt muscles if you've been sitting a lot, if your job requires you to sit because of your desk job, and if you have some back injury and you have difficulty engaging your butt muscles due to this pain that radiates down your leg. In this video, we'll be focusing on your gluteal muscles and how to activate the deeper glute muscles, the deep hip internal external rotators that will support your butt muscle. So no matter how much we strengthen your butt, if your hip mobility is tight, then there's less ability of your glutes to activate. Our body works together in a cohesive motion, and it's important to activate those muscles, have those deeper muscles engagement so that your pelvic floor is also engaged, and the floor helps the foundation for our overall core strength. And without the pelvic floor activating, then you will find yourself difficulty engaging your butt muscles. Example, when you do squats, you'll see your big toe lifting up. You'll be surprised that those little movements affect our pelvic floor all the way to your butt and your spine. So in this video, we will need a foam roller and elastic band to join me today. This video will be discussing about the importance of our gluteal muscles, on how it's so important to activate the deeper hip muscles that will support your pelvic floor. I'll be discussing about the importance of your hip internal, external rotators, as well as your pelvic floor as one of the foundation that will support your, guess what, your gluteal muscles. If you find yourself difficulty standing up on the chair and you find your big toes going up and unstable, then that's why we need to really be mindful on activating your hip internal, external rotators, as well as your gluteal muscles as a whole. If you're having tight hips, then you have less range of motion on the gluteal muscles to activate. So if you find yourself squatting and you can't go all the way down, or when you get up from the chair, you'll see yourself going up on your big toe like this, getting up, and you have difficulty grasping the ground. You have to really be mindful on really engaging our pelvic floor by thinking about pushing down your toes to the floor, really using your breath work. Breath work is key on activating our core. So as you get up from a chair, get up from the floor, or when you do your squat, you want to make sure you exhale through your mouth, like blowing through a straw. So if you just get up and holding your breath, and breath holders affects our pelvic floor. So if you find yourself picking up your grocery, getting up from a chair, and you held your breath, then that's a sign of weakness. And the more you do breath holding, the more you're affecting your pelvic floor. And that's when prolapse happen, back pain, pelvic instability. So in this video, we'll be using an elastic band. If you don't have the elastic band, you can still join me, and a foam roller for a deep release. So let's begin the program. We're going to start with proper breath work. We're going to place the foam roller on the side. We're going to place the elastic band around your thighs. If you need a good soft foam roller, comment foam right now. This is a 3-inch foam roller, FOAM, and I could send you the link of this very soft foam roller right now. Okay, my friends, we're gonna line your back with the elastic band around your thighs. So most patients, they have difficulty really feeling the hip muscles engage. You wanna learn how to do proper breath work first. As you take a deep breath through your nose, you're gonna feel expansion of your abdominal muscles. You can see my abs and my belly rising. So that's diaphragmatic breathing. When you do that, your diaphragm goes down and your pelvic floor is gently being stretched. And as you exhale, you zip it up from your lower abs to your navel. You want to use your fingers rolling up from your lower abs to your navel for a reminder, like zipping up a tight jean, to lift and engage your pelvic floor up as you breathe out slowly through your mouth, like blowing through a tiny straw. You can actually get a straw and place it in your mouth to help you get that mouth opening. Or you can use a balloon. The balloon is going to be harder, an empty balloon to blow. And that's why it's hard to blow to a balloon, because you're really engaging your core more when you blow. Again, take a deep breath, making sure your toes are grabbing the mat. So you see my toes are really pushing down to the mat to engage further on your pelvic floor. Take a deep breath, expand your abdominal muscles. Exhale, zip it up. Last deep breath in. You can see my abdominal muscles rising. Exhale, zip it up. Well done. Now, keeping your pelvic aligned. If you place a cup of coffee on your abdomen, on your pelvis, we're going to slowly lower one knee out to the side as you breathe out. So I'm going to start with my left. As I breathe in, expand, exhale, zip it up, lowering my left knee down, keeping my right knee straight, pointing up to the heavens as I breathe out. If I'm twisting my hips out, I'm going to slowly spill the bean to the left, the coffee beans to the left. So I don't want to lean to the left. You just want to make sure you lower your knee out to the side while keeping the other knee pointing up to the heavens, keeping my pelvis stable as I breathe out. Inhale, back center. You can see the expansion of my abdominal muscles. Exhale, zip it up to the other side. As much as you can to open the tight hips. As I said, I would rather have the hips not opening much, keeping the pelvis stable. Keeping my hands up here, my abdomen, for that gentle reminder I'm not twisting as I lower one knee out to the side. Breathe in as I go back center. Pressing my toes down to the ground as I go back center. Exhale, open to the side. Inhale, back center. Exhale to the side. Breathe in. Breathe out. Inhale. Exhale. 2 more to go as you inhale. Exhale. Feels so good on your hip groin muscles, and your gluteal muscles are activating slowly, and your hip external rotators. As I said, the hip external rotators support your gluteal muscles. Breathe in and breathe out all the way to your pelvic floor. Well done. Now we're going to do butterfly. So butterfly is both knees out, opening, keeping your pelvis stable the same way. As you breathe in, I'm expanding my abdominal muscles. Exhale, zip it up, and then open my knees out to the side as I breathe out. Inhale. Expand my abdominal muscles. Exhale, zip it up. Breathe in. Breathe out. Four more. Inhale. Exhale. Three more. Breathe in. Breathe out. Inhale. Exhale. Last deep breath in. Inhale. Exhale. Well done. Now we're going to further engage our core muscles and our hip flexors. So if you have tightness and weakness in your hip flexors, then your gluteal muscles will also not activate. So it's important to do both the top and the back end of our hips. So let's begin. Take a deep breath. We'll do tabletop, it looks like a top of the knee, like a table, and the knee bent to 90 degrees. Toes pointing away as you breathe out. Inhale, slowly lower your foot down. As you breathe in, expand your abdominal muscles. Exhale, switch to the other side. And you can challenge by placing your hands pointing up to the heavens for a little bit deeper core engagement. Breathe in and breathe out. But if you find this challenging, you can keep your hands on your side for more stability on your weak hips. So you don't want to spill the coffee beans. As I said, we don't want rotation on your pelvis. You want to keep it stable in the center of our core. Breathe in as you go down. Exhale as you switch. 4 more as you inhale. exhale. Breathe in, breathe out. 3 more to go. Feels so good in your hips, and you might find one side weaker than the other. Two more to go. Inhale, exhale. Last set. Inhale, exhale. Wow, then feels so good on your hips, right, my friends? Now, as I said, the hip opening is so important, right? Activate your glutes, external rotators. So you can challenge with your hands up here so you can see the visualization that what I'm gonna do. As you breathe in, breathe out, lift to tabletop. Slowly open your knee out to the side once you reach the tabletop. As you breathe out, I'm lowering my hand out to the side again and my knee out. They're all parallel together. Keeping my pelvis aligned. As I said, we don't want to spill the coffee beans to the left. Keep it center. If you can't lower it down and you see your body shifting to the left, then stop. I'd rather you keep it out just slightly open and maintaining that neutral spine and your pelvis aligned. Inhale, exhale down. As you breathe in, expand your abdominal muscles to engage your pelvic floor. Exhale, switch to the other side as you breathe out. Inhale, open slightly diagonal to the side, parallel with your hand and your knee, keeping the pelvis aligned. As you inhale and then exhale down, alternating left and right. Opening to the side, you're gonna feel that elastic band giving you that gentle resistance around your knees. It should be around your knees. If it starts rolling down, lift it up. Inhale, exhale, switch to the other side. Feels so good with the wind here. I'm here at Kerrville, Texas, the beautiful hill country. Beautiful views and the oak trees. It's springtime. Breathe in, breathe out. Out to the side, center, and down. Inhale, exhale. To the side, center, down. Last set. Inhale, exhale. Open to the side, center, down. Well done. Now, let's gonna further activate your gluteal muscles. Place your hands on your side. You wanna expand your abdominal muscles as you breathe in. Breathe out, zip it up. Roll your spine, pelvic tilt a little bit like this to engage your gluteal muscles. And then slowly exhale, blowing through a tiny straw. Zip it up from your lower abs to your navel as you slowly lift your hips up off the mat and breathe out. So if you notice, I'm not just lifting my butt muscles up. I'm really mindful with my breath, and I want to make sure my spine is not overarching like this. You don't want that. You want to make sure your butt is engaged. It looks like a slide going down. And once you reach up to this level, you take a deep breath again. You can see my abdominal muscles rising. Once I reach up, and then zip it up again from your lower abs to your navel. Lift, and then slowly roll down one vertebrae at a time from my upper thoracic, from my lower thoracic spine. Slowly, one vertebra at a time, going down to the mat as I slowly breathe out through my mouth. Again, mindfulness is important. We're not rushing. We're just really making sure you're doing the proper breath work. As you breathe in, expand my abdominal muscles. Exhale, zip it up and lift. And once you reach up, you take a deep breath again. Exhale, zip it up. Slowly roll down one vertebrae at a time. So you want to access my free 7-part video series about core back immersion therapy. Comment core, C-O-R-E, and you will receive the email in the next few days as I launch my 7-part video series, a free 7-part to learn more about core back immersion. Take a deep breath, zip it up and lift. Inhale, expand. Exhale, zip it up and slowly roll down one vertebrae at a time. If you leave a comment right now on our live, you can also access now. So comment CORE, C-O-R-E, if you want to access my free 7-part video series where I'll show you how to slowly engage your core safely and effectively if you have weak core, weak back, poor posture, and leakage, pelvic floor issues. And if you have excruciating back pain right now and you can't begin, comment coach right now, C-O-A-C-H, and you can access my free one-on-one consultation. Get my Calendly right now so you can talk to me in person via Zoom call with me. If you have any questions on if you're serious about fixing your back pain for good. Inhale, exhale, zip it up, and slowly roll down. Coach, C-O-A-C-H. If you want to talk to me via Zoom, you'll receive my Calendly. Learn more about Core Back Protocol. Core Back Protocol is a program under my back masterclass. Take a deep breath. If your problem is more back pain, SI joint dysfunction, poor posture, scoliosis, then this program is for you. And you can also access my free 6-part video series, Comment Masterclass. Master, M-A-S-T-E-R, class, C-L-A-S-S, to access my free 6-part video series. I have a lot of video series you can check out right now if you want to learn more about my programs. Last breath, take a deep breath, exhale, zip up and lift. And once you reach up here, we're going to progress. We're going to do a gentle pulsation in butterfly, small range of motion, holding that bridge. If you find this too difficult, then stop. I'm going to pulsate out as I breathe out. Small breath work. Inhale, back center. Quick inhale, quick exhale out. Inhale, exhale out. So I'm keeping my bridge, holding that position while I'm pulsating out, small range of motion, holding my core in. Breathe in and breathe out. 5, 4, 3, 2, and 1. Take a deep breath again. Don't plop. Slowly roll down, one vertebrae at a time. Well done. Whew, you're going to feel that beautiful burn on your glutes. Now, I'm going to grab my foam roller for extra challenge. So this is a 3-inch foam roller. If you need a soft foam roller, comment foam, F-O-A-M, and this is 3 inches. It's great to have that instability and give a little bit challenge. Hold on to the mat. We're going to do a bridge with marching. So this will challenge your hip flexors, challenge your glutes, and challenge your pelvic floor. Take a deep breath. Exhale, zip it up and lift. Zip it up. And once you reach that bridge, we're going to do gentle marches. Hold on to the mat for stability. As you breathe in, expand your abdominal muscles. Exhale, zip it up, and then march. 90 degree to tabletop. Inhale down, hold that bridge on the other side. Inhale, exhale, switch. Breathe in, breathe out. 5, 4, 3, 2, and 1. You can feel the burn. And then inhale again, expand, and then slowly roll down one vertebrae at a time. Well done. Now I'm going to place the foam roller underneath my pelvis to help that relief. And if you have prolapse, downward pressure, this is perfect. And we're going to continue strengthening our core muscles, lengthening our hamstrings. So our hamstrings actually originates on your sitting bones, the ischial tuberosity. So if you have tight hamstrings, it pulls down on your pelvic floor, it pulls down your back. So it's important to lengthen it, strengthen it. So take a deep breath through your nose from tabletop position. Exhale, let's do a gentle table tap, foot tap. So I'm gonna tap my foot down, keeping my other knee bent to 90 degrees as I breathe out. So I'm gonna do a modified dead bug. So as I lower my right foot down, I'm extending and lifting my left arm overhead, opposite side as I breathe out. Inhale, back center. Exhale, switch to the other side. Breathe in, breathe out. Inhale, exhale. This is a great way to really lengthen and strengthen your hip flexors. Using the foam roller as gravity assisted, so it's easier. It's good for if you have back pain, for gentle support. So you become more compliant to do this every single day. Last deep breath in. Well done. Now we're gonna do a gentle leg kicks. So as you tap one leg, go back to the center and then extend and lock your knee if you can as you breathe out. And then back to double tabletop and switch the other side as you breathe out. And then extend your right knee. You're gonna feel that gentle lengthening of your hamstrings. As you breathe in, breathe out. Inhale, exhale. Feels so good on your hips, your spine. Moving gently with intention. You want to be intentional on your movement. 4 more. Inhale, exhale. Don't forget your breath work and keeping your pelvis aligned without rotation. That neutral position. 2 more to go, my friends. So that gentle kicks help. Last set. Well done. We are progressing by doing a gentle diagonal movement. So when you do diagonal movements, you have that beautiful hip groin release. Your hip adductors are the mirror of your pelvic floor, which means if you palpate your inner thighs and you feel pain, then that's also painful inside. If you feel tightness, it's tight inside. And if you feel like it feels like a marshmallow on your inner thighs, then that's also your pelvic floor. Isn't that interesting? Okay, my friends. So now we're gonna do that diagonal motion with dead bug. So as I lower my right foot down to the side, a little bit diagonal, and then my left arm out to the side diagonal as I breathe out. You're gonna feel some clicking and popping on your hips a little bit, as long as there's no pain. You're gonna feel that beautiful hip opening. And you're engaging your gluteal muscles, as we said earlier. Those gentle hip range of motion helps activate your weak glutes. If you're sitting a lot, your butt muscles are not activating, you feel like it's dead butt syndrome or gluteal amnesia. So this is a great way to wake them up. Inhale, exhale, to the side a little bit. Intentional, mindful movements. Breathe in, breathe out. 4 more. Three, 2. Last set, my friends, and 1. Well done. Now extend your legs, feel that beautiful stretch on your hamstrings. Hold into the one leg. So I'm holding my left thigh, interlocking my fingers and lowering one leg down for gentle stretch as I breathe out. Eccentric control, hold that stretch. Inhale, back center, then switch to the other leg. Interlock your thigh and breathe out. Lower the other leg down, toes pointing away as you breathe out. Inhale, back center, and then switch again and breathe out. Breathe in and breathe out. 4 more. Feels so good to stretch and lengthen. 3 more, my friends. Two more. Last one. Well done. Now we're gonna lie on your side. You wanna activate your hip external rotators, as I said, and internal rotators. I'm gonna use the foam roller to lie on my hips here and lie on it. I will just place it on my shoulder for extra support underneath my armpit. It's really soft, so it's comfortable. It's almost like a pillow. Bend your knees to 90 degrees. Hold on to the foam roller for stability. Slightly lean forward so you can really activate your glutes as you breathe out and lift to clamshell. Inhale down, exhale lift. Breathe in, breathe out. Inhale, exhale. 4 more. 3, 2, don't forget your breath work, and 1. Now we're going to do parallel climb. We're going to lift the top knee and foot at the same time, keeping it parallel as you lift. Breathe in, breathe out, lift. Feel the burn. Inhale, exhale. 4 more. 3, 2, and 1. We are progressing. We're gonna lean on the foam roller with your hands down like this. We're gonna do side plank. So side plank is like a gentle core engagement, engaging your glutes, your core, and your obliques and your shoulders. So you're gonna slowly lean on your both knees up like this for beginners, and balance, and then clamp, and then down. Take a deep breath and lift. So the foam roller gives you that extra challenge. 4 more. And lift, keeping your hand pointing straight to the heavens as you open your knee up. 3 more. 2, it gets harder, I know. And last one, my friends, and 1. Whew. Clamshell with plank. You're gonna feel that burn on your hips and your glutes. Now switch to the other side. We are almost done, I promise. Lean slightly forward, hold on to the foam roller, and we'll do clam. Core engaged, don't forget your breath. We're slightly lean forward. 4 more. 3, 2, and 1. And then parallel climb your knee and foot up, and breathe out. Feel the burn. We're almost done. It's the last stretch. 4 more. 3, 2, and 1. Woo! And now, with your hand on the foam roller, this is 3 inches, an extra elevation and challenge. Core engage, and breathe out as you lift, making sure your hand is level to your shoulder as you plank up, and then clamp, and down. Inhale, exhale, lift. This is modified version. 4 more. 3, 2, lift, and then clamp. Last one, and 1. Well done. Okay, my friends, we're cooling down now. Placing the foam roller underneath your hip flexors for gentle release. This is a soft foam roller. If you don't have a soft foam roller, you can use a roll towel. And then lower your hips down, your chest down. We're gonna do a gentle glutes activation with your knee bent. So with my left knee bent, left toes pointing up to the heavens, and then lift up. Really mindfulness on engaging your butt muscles as you breathe out. Breathe in, breathe out, lift. 4 more. 3, 2, and 1. And then switch to the other side, extend your leg, and then right knee now is bent, toes pointing to the heavens, and breathe out and lift. Inhale down, exhale, lift. 4 more. 3, 2, and 1. Now with your leg extended, so it's a different challenge. You're engaging your hamstrings a little bit with your leg extended. So with your leg extended, lifting up, you're activating your glutes and your hamstrings. Inhale, exhale, lift. 4 more. Breathe in, down, exhale, lift. 2 more. Last one. And then switch to the other side. Breathe in, breathe out, lift. Inhale, exhale. 4 more. 3, 2, and 1. We are challenging by lifting both your knees up. Bend your knees and lift your knees off the mat to engage your glutes more as you breathe out. So the foam roller gives you that assist. So it's very soft, it's very comfortable underneath my pelvis. So bend your knees and lift. Breathe in, down, exhale, lift. 4 more. 3, 2, and 1. Well done. We are progressing by placing the elastic band around your ankles. We're gonna do hip internal rotations in prone position. So with the band around my ankles, my knees together, I'm separating my feet apart as I breathe out. Inhale, back center, exhale, open. 4 more. 3, 2, and 1. Well done. Now we're going to hands and knees position. Hands level to your shoulders, knees level to your hips. We're going to remove the foam roller around your ankle and place it around your thighs again. We're going to do some lovely donkey kick with your hands level to your shoulders, knees level to your hips. You can place the foam roller on your hands for extra core engagement, for the instability and a little bit elevation, and lift the back knee level to your hip, toes pointing to the heavens as you breathe out. Inhale, back down, exhale, lift. 4 more. 3, 2, and 1. And then switch to the other side. Take a deep breath and lift. Inhale down, exhale, lift. 4 more. 3, 2, and 1. And now we're gonna do cars, which is a nice hip mobility drill to really activate your mobility flow and really activate all the hip muscles. So we're gonna start with the fire hydrant and then back to donkey kick and then down. So as I breathe in, breathe out, fire hydrant, donkey kick, and down. So you're making that beautiful rotation, slow and steady. Donkey kick, fire hydrant, and donkey kick. Last set. And then we'll do reverse. We'll start donkey kick first and then fire hydrant. Donkey kick first. So you're like making a big circle but with your knees bent. 2 more. Last one. Whew, well done. Now lower the elastic band a little bit around your thighs. We're gonna do lovely cars on the right side. So we're gonna start with fire hydrant, donkey kick, and down. Breathe in, breathe out. Inhale, exhale. Mindfulness, control with your breath. Last set. Well done. Now we'll do reverse. Start with donkey kick and then fire hydrant. Donkey kick back and then open to the side. 4 more. Breathe in and breathe out. Up, fire hydrant, and down. 2 more. Feel the burn. Even the stand where you're kneeling area will work hard. Last one. Whew. Well done. We are progressing. I know you guys, we're almost done, I promise. We're gonna do some extension with your leg and lift off. Engaging your hamstring core engage as you breathe in down, exhale, lift. 4 more. Up and down with your knees straight. 2 and 1. And then switch to the other side. Extend your right knee and lift. Inhale, exhale, up. 4 more. 3, 2, and 1. And then we're gonna do a lovely rainbow movement. So extending my left leg this time, I'm gonna go up, around, and back out to the side of the mat. Up like a rainbow or wiper. In and out. 4 more. 3, 2, and 1. Now switch to the other side. Extend your right, out to the side and in. Inhale, exhale. 4 more. We're almost done, I promise. We're cooling down soon. 3, 2, and 1. Well done. We are cooling down now with the pigeon stretch. Knee bent. Extend the other leg and roll down the foam roller forward for deep stretch on your glutes and piriformis. So with my knee bent, if you can handle it with your knee, and then down to stretch. and hold this in 5 deep breaths. I'm hoping you guys enjoyed my lovely Sunday live stream. Our glutes activation to help your core strength. If you need my help and guidance, comment coach right now, COACH, and you can have a free consultation with me to learn more about core back protocol if you are very serious in fixing your back pain right now, to eliminate back pain fast in 14 days. If you want to start doing this without problem or spasm, I could guide you to make it to this level. I know this looks advanced right now, but those who graduated in my program from having issues with their back pain, deconditioning from breast cancer survivor, or I have new patients now with scoliosis and they're getting better, or a failed surgery under hysterectomy. This is a program that's safe for you. Now let's switch to the other side. Or if you had the hysterectomy many years ago and you haven't felt the same way, oh, it's very windy here, then this program is for you. My back masterclass, core back protocol, if you're interested to eliminate your back pain fast for good and really get back to your old self. Take a deep breath. We're on the other side now, cooling down. And now we'll end it with child pose, but with a little bit special, with your knees out to the side and down. Roll the foam roller out as you take deep breaths. Woo, hold it in 5 deep breaths. And if you want to access my free series, comment CORE, C-O-R-E right now, and you'll receive it via your DM box, your messenger, or comment masterclass if you want to learn more about my free 6-part video series about core back protocol. And that's it. I'm hoping you enjoyed this lovely mobility drill. I'll see you again next time. If you have more time today, I have a video about core back protocol over here, and this video about proper breath work. Until my next video training, have more time today. I have a video about quadratus lumborum pain, which is a one-sided weakness. Check out this video over here if you have back pain in one side only. And in this video about my dextroscoliosis videos to help align your pelvic misalignment. Until next time, always remember, be safe, be well, and healthier you. Bye!